Hello everyone, this is me Nabila Abbas. I'm from Pakistan, a young social activist working on the Rural Development Initiative and for the rights of young rural girls since 2016. Today on Community Connect World Conference on Lung Health 2022, I have this privilege to share one of the most important topics in the field of medical, and that is breast TB. I have two strong facts for which I have this determination to share this topic and to open about this topic on this conference is that number one, because I have experienced and survived this disease, and that is why it was important equally to propagate the agenda towards the right people through this conference. Number two, because being the fact this disease as a rare disease, as a 4% among women around the globe, is also equally important to propagate towards the right people like the women around the globe. Just wanted to touch the background of this disease, that how I got familiar with this term. On 27 November 2018, one morning I woke up with severe pain in my right breast. I was living in hostel at that time and was studying undergraduate program at university. I asked my friend if I should need to visit a doctor. At the moment, we could not figure it out. On 6 December 2016, I with my friend got urgent appointment in emergency ward, Jinnah Hospital, Lahore. I was almost dying with a severe pain and an infectious discharge from my right breast. I could not understand when the doctor wrote breast abscess TB contact diagnosed. How the time frame 2018 and 2022 became a struggling time period, not only for me, as well as for the doctors too, to determine breast abscess to breast TB. Despite the fact TB is now a common disease all around the world and its few very basic types are none, lung TB is one of those common types. It was the main cause that breast TB is rare, 4% among women around the globe, though very similar, just like other common TB. However, it became a struggling period to figure it out exactly how to treat my breast abscess. It was named several times with new term, a breast infection, a breast abscess, a breast skin infection, etc. Lately, due to severe symptoms and failure of treatments, I moved from doctors to doctors. Ultimately, through some minor surgeries and biopsy, a doctor named Shafiq Esrani diagnosed it saying breast TB. And I was urgently asked to go through few minor surgeries and to secondly get TB course from TB medical ward at the hospital. I just wanted to point out it here that this time period has not become a struggle for me, but also it became a struggle for the Pakistani doctors as well to ultimately define it as a breast TB, despite the fact that it is a rare disease around the globe among women. And secondly, because every woman, almost every woman in this world consider anything happening to their breast, they consider it like falling into breast cancer either. So I have also these doubts and fear as well in my mind during the time period. Introduction about the disease breast TB. I just wanted to define it in a very general information for those people for whom it is a new term, especially so that they can have the idea. Tuberculosis of the breast is an uncommon disease even in countries where the incidence of pulmonary and extrapulmonary tuberculosis is high. Clinical presentation is usually of solitary, ill-defined, unilateral hard lump situated in the upper outer quadrant of the breast. This disease can present a diagnostic problem on radiological and microbiological investigation, and thus a high index of suspicion is needed. So the diagnostic problem has also been a big problem in my case as well. Incorporating a highly sensitive technique like polymerase chain reaction may be helpful in establishing the usefulness of such technology and can aid in confirming the diagnosis early. The disease is curable, surprisingly, with anti-tubercular drugs, and surgery is rarely required. Tuberculosis breast TB incidence. Tuberculosis mastitis is a rare extrapulmonary presentation of tuberculosis, accounting for less than 1% of all diseases of the breast in the industrialized world. Incidence of this disease is higher in countries endemic for tuberculosis, like the Indian subcontinent, where it may be as high as 4%, In the Arabian Gulf, the frequency of the disease is reported to be between 0.4 and 0.5%. And surprisingly, being I myself as victim of this disease, breast TB, I belong to Asian continent from Pakistan. Sir Ashley Cooper reported the first case of tuberculosis mastitis in 1829 and called it superfluous swelling of the bosom. So I myself been going through this disease in the past few years. I have been going through a lot of internet research, and I have been reading a lot of cases about breast TB as well. So it was really surprising for me as well that this disease actually exists in the past as well, like in 1829, but definitely it was named a different disease at that time too because of the diagnostic problems. Tuberculosis mastitis may be part of a systematic disease or may be the only manifestation of tuberculosis. It occurs for more frequently in women, especially in their reproductive age, and is uncommon in prepubescent and elderly women. This parallels the highest incidence of pulmonary tuberculosis. This would be because the female breast undergoes frequent changes during the period of childbearing activity and is more susceptible to trauma and infection. This disease is very rare in males. In a review by Gupta et al. Comprising 160 patients, only 6 were males. The risk factors associated with the tuberculosis mastitis include multiparity, lactation, trauma, past history of suppurative mastitis, and AIDS. Patients will frequently be symptomatic for at least a few months prior to diagnosis. It may be difficult to differentiate from carcinoma breast, a condition with which it may coexist. Clinical presentation of the breast TB. The most common clinical presentation of tuberculosis mastitis is that of solitary, ill-defined, unilateral hard lump situated in the central or upper outer quadrant. Just like in my case, I had a lump over upper outer quadrant on my right breast. The lesion may be indistinguishable from carcinoma breast, being irregular, hard, and at times fixed to either skin or muscle or even chest wall. Multiple lumps and bilateral involvements are uncommon and occur in less than 3% of the patients. The lesion may progress to a tuberculosis ulcer over the breast skin and tuberculosis breast abscess with or without discharging sinuses. In a series of 30 patients recently reported by Tiwari, 22 patients presented with lump in the breast. 11 of these had tubercular ulcer and 4 had multiple discharging sinuses in the overlying breast skin. And in my case, I also had, like for the past 6 to 9 months, I also had a discharging sinuses even during my TB course as well. 1/3 of the patients have breast pain with or without increased breast nodality, and 1/3 have aspirator axillary lymph node involvement. Pulmonary involvement occurs only rarely. Another form of presentation in recent years is tuberculosis breast abscess. This form is described to be more prevalent in endemic area TB and presents usually in young females. Classification of breast TB. Even though being the disease itself as a rare disease, the classification of this disease, even in the past and historical, being a very difficult era. But McEwen et al. Classified tuberculosis mastitis into 5 pathological varieties. The nodular form is the most common variety and usually presents as a localized, slowly growing mass that progresses to involve skin, may ulcerate and can form sinuses. Histological, this form is characterized by extensive cessations and little fibrosis. The diffuse or disseminated form is the second most common variety and involves the entire breast with multiple intercommunicating foci of tubercles within the breast, which cessate, leading to ulceration and discharging sinuses. The overlaying skin is thickened with multiple ulcers. Aspirator axillary lymph nodes are usually enlarged and matted. This form is more common in older females and may be confused with malignancy. The third type described by McEwen is the succularizing form. This variety demonstrates extensive fibrosis rather than cessation, in which the entire breast is hard and the nipple is retracted. This form is often seen in involving breasts of older females and may be also mistaken for carcinoma breast. The last 2 forms described by McEwen are tuberculosis mastitis obliterans and acute miliary tuberculosis mastitis. Tuberculosis mastitis obliterans is characterized by duct infection producing proliferation of lining epithelium and marked epithelial and periductal fibrosis. The ducts are occluded and cystic spaces are produced resembling cystic mastitis. Acute miliary tuberculosis mastitis occur as a part of generalized miliary tuberculosis. Both forms are rarely encountered in recent literature and may be of historical importance only. Tiwari has recently suggested reclassifying breast tuberculosis into three categories, namely nodular, disseminated, and abscess. The new classification takes into consideration the changes seen in the clinical presentation of tuberculosis over the last 2 decades. Sclerosing tubercular mastitis, tuberculous mastitis obliterans, and acute miliary tubercular mastitis are all very rare today, while tuberculosis breast abscess is more frequent. The latter is common among young female and represents up to 30% of cases in recent publications. Routes of the infection. Tuberculosis involvement of breast occur either by direct inoculation of the bacilli through abrasions in the nipple, which is rare, or more commonly via lymphatic hematogenous or contagious seeding. The lymphatic route is the most likely route of breast involvement, which occurs by retrograde extension from the axillary lymph node. This hypothesis is supported by the involvement of axillary nodes, frequently epilateral nodes, in 50 to 75% of tuberculosis mastitis cases. Contagious spread occurs from the ribs, pleural space, or rectus sheath from an intra-abdominal source. Lymphogenous spread is rare and occurs in cases of disseminated tuberculosis. Diagnostic strategies. As I have discussed earlier, that in the history and in the literature of the TB, and especially for the breast TB cases and incidents, the diagnostic strategy and process had been a bit difficult process, and it had not been clarified so far. But the gold standard diagnosis of tuberculosis mastitis is by pathological culture of breast tissue or by Ziehl-Neelsen stain. However, in tuberculosis mastitis, the bacilli are isolated in only 25% of cases, and acid-fast bacilli are identified only in 12% of the patients. Therefore, demonstration of desiccating granulomas from the breast tissue and involved lymph nodes may be sufficient for the diagnosis. Fine needle aspiration is the most widely used initial invasive method for diagnosis of the breast tuberculosis. Approximately 73% of the cases of the tuberculosis mastitis can be diagnosed on FANIC when both epithelioid cell granulomas and necrosis are present. In tuberculosis endemic countries, the finding of granuloma in fine needle aspiration warrants empirical treatment for tuberculosis even in the absence of positive acid-fast bacilli and without culture results. An excision biopsy is strongly advocated, however, to rule out other diagnoses like sarcoidosis, fungal infections, ductular ectasia, and a coexisting malignancy. Adequate tissue samples are not usually possible with fine needle aspiration. Radiological tools like mammography, computer tomography, and magnetic resonance imaging of the breast have all been used in diagnostic workup of breast lumps. Either mammography or ultrasound of the breast may demonstrate a dense sinus tract connecting an ill-defined breast mass to a localized skin thickening. This sinus tract sign, originally described by Macanjola, may be strongly suggestive of tuberculosis breast abscess, but is found in only a small percentage of patients. Radiological tools are generally helpful in defining the extent of the lesion, but not very helpful in differentiating tuberculosis from the other differential diagnosis, for example, malignancy. And it is equally important to highlight it here that in my case, even though I have gone through from 6 to 9 months medication TB course of the breast TB, but parallel, I have to go through 4 minor surgeries of my breast as well. Treatment. Medical therapy is the manifestation of therapy with anti-tuberculosis therapy. No specific guidelines are available for chemotherapy of breast tuberculosis, and therapy generally follows guidelines used for pulmonary tuberculosis. So the success rate for the treatment of the breast TB are just like the other common forms of TBs, and 6 to 9 months of the medication course is usually instructed with following the other guidelines, and that is enough as a treatment, and success rate is being counted towards this method as well. So I have also gone through the same process of treating my breast TB by implementing 6 to 9 months of the medical course for the TB treatment. Surgical intervention was needed in up to 14% of the patients in some series, as like I have also mentioned about my specific incident that I have also gone through by 4 minor surgeries parallel to my TB course. So historically, by the data of the literature, 14% of the patients were seen involved into surgical interventions, either due to lack of response to the chemotherapy or large painful ulcerative lesions involving the entire breast. Drainage of cold abscess in the axils and breast to prevent sinus formation is mandatory. Axillary dissection may be required in patients with large ulcerated nodes. Simple mastectomy is rarely needed nowadays and is reserved for patients with extensive disease comprising large painful ulcerated mass involving the entire breast and draining axillary lymph nodes. Tuberculosis of the breast is uncommon even in countries where the incidence of pulmonary and extrapulmonary tuberculosis is high. This disease can present a diagnostic problem, as we have discussed earlier, on radiological and microbiological investigations, and thus a high index of suspicion is needed. Incorporating a highly sensitive technique like PSR may be helpful in establishing the usefulness of such technology and can aid in confirming the diagnosis early. The disease is curable with anti-tubercular drugs and surgery is rarely required. So this is really important and really equally important to highlight that TB is curable. This is a good news for all those whom have been suffering by this disease, either other form of TBs or breast TB. So the TB is curable with the medical course, and there is nothing as such to stick any kind of stereotypes or stigma about TB disease. Why it was important for me to break the silence and advocate the breast TB. Though the breast TB is a rare disease, but it is equally important to advocate the agenda, as it can lead to breast cancer if not properly diagnosed according to the past literature and some past incidents. I had been battling with this disease for the past 3 years, though I am now completely cured and fine. I was surprised to see my written blogs became a source for few women who contacted me and was suffering through the same breast TB symptoms and cases. It was important to advocate breast TB despite the fact few cultural norms and taboos completely stopped women in discussing the disease openly, just like I had also gone through such phase of facing taboos and cultural norms. I was told not to open about breast TB as I would not get a proper match for my marriage, which I of course denied. My experience encouraged women and educate other people that TB, either of any form, is curable and you can happily resume your life activities, as I graduated from my university in the same year when I was even battling with the disease too. So the whole idea of this, sharing this information as well as my experience as a survivor is to encourage other young girls and women around the globe that they should shift these stereotypes now and they should eradicate all kinds of stigma towards this disease, and they can happily live their life and they can survive it with determination, bravery, and by educating not only others, but first educating themselves. Thank you so much.